Hello, everybody. My name is Leila, PL Valete, and I am the Health Education Manager here at AiArthritis, and I am excited to report back on day 3 of EULAR 2024. Today, right now, it's actually Saturday, which is day 4 and the last half day of the conference, but I ended up staying home and resting because the past 3 days have been really taking a toll on my body. I actually got sick a little bit with a cough right before I came here, and I also have sickness-induced asthma. So walking as much as we've been walking, the 8 to 9,000 steps we've been walking per day, going to our sessions, our interviews, and our meetings, it has been a lot on my body. So the team and I decided that it would be best for me to take a break today. And so, I'm here at the apartment, getting some work done. Since after the day yesterday, I was so exhausted, I ended up kind of just laying in bed all day. So I'm feeling a lot better after resting for a whole half day. And I am excited to talk to you about the session that I went to yesterday. And I will still be doing a few more debriefs on sessions after we get back home. Today is Saturday, so they have the half day at the conference, and then we have a day and a half to kind of go sightseeing before I go ahead and head home. So once we head home, I take a few days off to rest and to recover, and then right back to it. So hopefully by the end of next week, we'll have a few more debriefs also up on YouTube for you all to enjoy. I know there's a few lupus and pregnancy sessions that I did want to get to and report back on, so you can look forward to that. And I'll also see if there's any other very interesting ones that are more translatable across all of our disease states, to see if there's anything else we can report back on for you too. So the Go With Us program is amazing, and the elevated experience gets to see face-to-face what we're doing day to day. And even with the email experience, you are still able to get like some updates and mostly getting these takeaways. So it doesn't just end here. There will continue to be a few more sessions that we talk about, and let us know what you think about the program. Leave us any comments down below, and super excited to talk to you about this last session that I saw in person. And this one is near and dear to my heart as well, and it is the transition from pediatric to adult care, and adherence, and how difficult it can be for teenagers to stay adherent to their medication while transitioning as an adult. And I was diagnosed with lupus when I was 12 years old and ended up going away to college when I was 18. But I had my first major flare when I was 6 weeks away from moving into my college dorm. And in the US, we have health insurance that once you're 18, your parents can no longer make appointments for you. You have to make all your decisions by yourself and go and find the doctors on your own. So once I was at my college, the first thing I had to do was get a primary care doctor, get a rheumatologist, and within the first month of me moving into my dorm, I started Benlysta for the first time. So that was a very tumultuous time in my life, and I wish I would have been better prepared to be able to handle my care at that point in the transition. And so I really wanted to be able to talk about this, because not only do we cover our 22 diseases, but also the juvenile forms of the diseases. And even with JIA, there's so many different subcategories of JIA, and there's a lot of young people living with these diseases. So just having these recommendations is really important, and just recognizing that the transition from care from pediatric to adult, it can be really tough if it's not brought up and planned for accordingly. And so there was 5 speakers that spoke at this session, some of them being patient perspectives as well as rheumatologist perspectives, and talking about tools and other tips to be able to make the transition as smooth as possible. And as always, I have my notes on my phone, so if you see me looking down, I'm looking at my notes. And so the first thing they talked about a lot is adherence. And adherence really means being able to stick to the treatment plan. And treatment plan does not necessarily only mean medications and drugs. It also has to do with therapies, physical therapy, occupational therapy, making sure you're attending your regular appointments, getting your blood work on time, and all of these, any imaging. That is all a part of adherence and adhering to a treatment plan. And even if there is the best drug in the world, if you don't take it the right way at the right time with the right amount, it doesn't mean that it's going to be as effective as possible. And around 40% of treatment outcomes are influenced by adherence, but most research only really focuses on the efficacy of the drug itself. And when you're coming from kids to adults, from pediatrics to adults, it's a totally different world, because when you're pediatrics, when you're diagnosed at 8, 12, at any young age, your parents are the ones kind of making the decisions with you, rather than you really being able to voice your own opinion at that time, which makes sense, right? At that age, you may not be making the best decisions for your health. You may be making decisions off of other influences, like friends or opinions, wanting to feel normal, not wanting to take medication. And so it really is important to have the parents involved during those younger stages. But it's also really important to start to release control and release that sense of taking care of the kid, instead of working with the child or the pediatric to be able to be autonomous and make decisions for themselves, and also be able to take care of themselves, taking their blood pressure if they need to, taking their temperature if they need to, just really owning and being accountable for their own health. And so during adolescence, between the ages of 14 and 24, adherence drops. When you're in high school, when you're in college, during this young adult age, it gets really hard to feel different and to feel like there's this disease that's weighing you down. And unfortunately, a lot of people who have our diseases at that age feel that way. And that translates into skipped doses, missed appointments. Life kind of gets in the way sometimes, and it can be really tough, because you do just want to live a normal life, unfortunately. And many young people, during this transition, the biggest thing is being able to understand their own medication. They're used to mom putting it in front of them and saying, take the medication, and not really understanding what the medication is used for, what the name of the medication is, how much they're supposed to take, or anything like that. So having children be involved in creating that safe space of learning about their medications and learning why it's so important to take their medications is really key. I was very non-compliant when I was a kid, especially from ages 8 to 18. I never wanted to take my medicine. I would flush it down the toilet. I would throw it in the garbage. I would do everything that I could to not take it. One, because I hated the way it tasted, and two, when it was prednisone that I was on a lot, I knew that it made me gain weight and it made me feel so bad about myself. And so that was really tough for my mom to deal with, because she would just get mad at me all the time, and I couldn't really understand why it was so important for me to stick with this treatment. When transitioning with younger adults into their autonomy and their adulthood, it's really important to make it a journey and not a jump. Slowly transitioning and really giving the support needed is important, not from just the family, but really starting from the care with the rheumatologist, with the nurses, with the NP. It really does help for the healthcare providers to bring up the idea of transitioning care early, so that patients and families can be aware that this is something that needs to be tended to, something that we need to take care of. And yeah, definitely patients and families just need more support when it comes to this area in particular. The biggest thing also is just having honest conversations. What is the patient's preference? What will make them more adherent and less disruption of their lifestyle? Versus injection, and how to make injections more comfortable. All of these things are important, taking into consideration the patient's preferences and what may be deterring them from sticking and complying to their treatment plan. And building relationships with patients is really important for patients to be able to trust and know that the healthcare practitioner really cares about them and wants the best for them and is giving them a treatment plan that is tailored to them, personalized. And lastly, I wanted to talk about a tool that they talked about. And there's tools like Compass 31 and HEADS assessment that help screen for quality of life and psychosocial issues that often can be missed in clinical care. And again, with this adolescent population or young adult population, that's really, really important. They also bring up the idea of rheumatology practitioners to maybe even have, offer more flexible appointments or virtual evening, weekend, that can also really help patients and families help to adhere to their treatment plan. And last but not least, everyone's role matters in this. The child, the parent, the healthcare practitioner, the support, that really is really important. And I think the biggest thing that I also took from it is that the healthcare practitioners only have a certain amount of time with each patient, a few times a year. What really is important is outside support. So finding organizations like AiArthritis, like the Arthritis Foundation, or the Juvenile Arthritis Project, or Purple Playas for other chronically ill juvenile patients. It's really important that they don't feel alone and isolated, and that can help them feel more empowered to adhere to their medication, understand that this medication can help them feel better if they're having lots of other symptoms. Patient organizations can really help bring in that extra support and extra help to patients and their families that unfortunately, that the healthcare practitioners don't really have the time to be able to dedicate and make sure that this transition is going smoothly. So you are in the right place of finding AiArthritis, and lots of other patient organizations also have a lot of support for transition of care and community to have patients just not feel so alone. And yeah, I think that this was a really cool session. It was great to hear the conversation happening about specifically this topic of transitioning from pediatric care to adult care. And I really appreciated the session and hearing about all the strategies to make sure that patients feel supported through this hard transition, not only in their everyday life, through high school and college, but also additionally dealing with an autoimmune or autoinflammatory arthritis disease. Alrighty, well, I will talk to you all soon, and have a great day. And thank you again for joining us for Go With Us EULAR 2025.